So from where you're coming?
I'm coming from UK.
UK. Okay. What issue you have?
Lipomas, multiple.
Okay. For how long you are having this?
I think possibly in 15, 20 years.
15 to 20 years.
Yeah, maybe more.
Okay. So what all you have done? Any precautions, diet changes, whatever?
Well, I never really tried much of the diet changes because I didn't really believe that they worked. I did some research into it and it never seemed to work anyway.
So you have done the research or you just
I've read some research about it, yeah, and I usually find that the best solution is extraction, so
you are lucky that you found this, because so many people, when they read, then they know about injections, then they know about diet changes, then they know about so many medicines which are in the market. You had any experience with them, or?
Like I say, I hadn't really tried it because I did when I did the research, I was finding that people would try them and eventually they would realise that extraction was the best means to get rid of them permanently. So,
okay. So in your experience, most of the people, if you know, or in your research, is it correlating with the genetics more, or it's do you know, like it's for anyone it is just like it's
I mean, I don't really know much of anybody else who's got them. My sister started to develop a couple of her arms.
She already got
so I'm guessing genetic wise, yeah, I'm guessing it's probably on my dad's side, you know.
Normally in 90 to 95% patient I have seen there is some genetic correlation, but sometimes it is we are not able to find it.
Yeah.
Okay. Any relation with the food? You find any changes with the food in this?
What in terms of what I was eating?
Okay, it started. This is the usual time, but anything related to your diet? You think if you are taking a lot of fatty meals or something, is it changing it, or anything? If you're doing
I can't say I've noticed either way. I mean, I try not to eat a lot of fatty stuff all the time. I eat a lot of fruit anyway every day. I try and eat some veg, and like I say, I don't tend to eat badly that often, so my diet's not too bad really.
So what was the reason you thought of removing those? Is it social, psychosocial, or
it was because
physical?
Part of it was because when it was summertime, it was hot. I never wanted to wear a short sleeve t-shirt because I didn't want to show them off. But I hate the fact that I was really warm and I couldn't enjoy the sun properly.
Okay, that was one thing.
Yeah.
You had some on the body also. They used to pop up.
Yeah, I have quite a lot on my body as well, and that affected me in the sense of like, if I was to ever go on a holiday, I wouldn't want to necessarily get in the pool or things like
especially for the sunbath, or especially when you are swimming, you tend to.
So they put me off really.
You had some in the legs also. That also.
Yeah, there was more like the top area of the legs. The lower area of the legs seems to be okay for the most part, I think.
So what all research is there yet? You have tried to do surgery at I think UK also.
I tried to do surgery within the health system in the UK, and the results weren't pleasing to me at all. I felt like they were overly cutting the skin, just instead of like trying to think of a more cosmetic, appealing process.
Okay. So how do you think? What is your experience today?
I'm very happy with it, especially compared to what I've had before. I think it's a lot more pleasing to the eye, and I wasn't as hesitant as I went done coming here because I knew my body wouldn't be a mess afterwards.
When was the reason you were not thinking of any big incisions because of that long big scars? They do the same way that they have done the previous.
Yeah.
This was the previous done at UK, I think. This one was the one. This one also you had done. Somewhere here also you had done, I think.
There was one down here, this one now, and obviously there's the one there.
Okay. Now you can see this is the small hole which we have taken. If you can go through this. This is such a small hole. And some of them have already healed by the time we have finished the process. If I remove this, I know it is sticking to the hair. But if you see, this is already healed. Then if I don't put any band-aid, this is done. But still we will keep it for another 3 to 5 days. That's it. Pain, discomfort?
No, not really. No.
And what were doubts in the mind when you were thinking of traveling to India?
I was concerned about it just because it was so far away and I didn't know fully what to expect. But
it's very much natural. Some apprehension is always there, and especially coming to India is sometimes more.
I've never travelled this far on my own. I've never travelled on my own anyway, so
So you mainly travel in
Like with
Europe
with
only?
family or something, yeah. So yeah, it was quite daunting, really.
Okay, great. So you will have a good recovery. I'm very hopeful there will not be any issues. Today morning you came to tonight or tomorrow morning you're flying back.
I'm flying back in the early hours of tomorrow morning. Yeah.
I'll come back tomorrow.
Yeah.
Okay, best for your journey.
Thank you very much.
Anything you want to know or you want to share your experience about the disease?
Yeah.
For any information if you want to pass to your friends or those who are seeing this video for the lipoma information.
Yeah, I've already spoken about with family and anyway and stuff. I told them that I was planning on coming here and stuff and what I'd seen and why I wanted to be here, you know, the reasons why. So yeah, I'm quite happy to mention it to people if it helps them if they've got the same condition. You know.
Okay, great. Okay, thank you.
Mhm.